Hi everybody, welcome back. It's your boy Adam. Today we have a book called The Human Body. This book tells you about structure, function, and disorders. So all the medical topics we've done will be inside this book. So we are going to be reading this book, The Integrated Body. Alright, imaging the neck and head and neck. Techniques for visualizing the head and neck range from endoscopy of the inside of the hollow structures such as the larynx to complex computer-aided techniques for imaging structures deep within the brain. The head and neck region connects the brain, protected by the skull, the spinal cord, and the vertebrae. And the eyes and the ears, the nasopharynx, nasal cavity, and throat and larynx, which form the upper part of the respiratory system. And the teeth, tongue, and upper esophagus are the start of the digestive system. Some of these structures can be viewed directly. For example, the larynx and nasopharynx can be viewed with an endoscope for deeper and more detailed views. Ordinary X-rays can produce images of the skull and vertebrae, but do not generally produce clear images of soft tissue. For such tissue, CT and MRI scans give more detailed images. Techniques such as the functional MRI and radio include scanning, can also be used to reveal how tissues are functioning. So, let's continue. DTI scan of the brain. Diffusion tensor imaging is a form of MRI that can show details of tissue architecture in this image. Nerve fibers running from the front of the back of the brain are colored green. Those running left to right are red, and those running top to bottom are violet. Cardiovascular system. Actually, we'll do the nervous system. CT and MRI scanning enable the brain, brainstem, and spinal cord to be shown in detail. Most of these images show a 2D slice through the tissues, but images may also be combined by computer to create the 3D model of the brain, CT and MRI. Scans are commonly used in the diagnosis of disorders such as tumors or bleeding within the skull. Functional MRI could show blood flow through the brain, which indicates levels of neural activity in different parts of the brain. Radionuclide scans such as PET and SPECT can show levels of metabolic activity within brain tissues. For example, uptake of oxygen and glucose. These can reveal overreactive areas, possibly indicating a tumor or underactive regions, which may be a sign of Alzheimer's disease. We'll talk about Alzheimer's a little bit. Right, this here. Okay, little strip on my nose because of allergies, so yeah. Cardiovascular system. The carotid arteries, jugular veins, and other blood vessels in the head and neck can be revealed in detail by angiography. In contrast, angiography, a chemical opaque to X-rays. The contrast medium is injected in the blood vessels so that they will show up clearly on X-rays or on CT scans. Such scans can reveal blocked or narrowed areas or abnormalities such as aneurysms, bulging, weak areas of artery wall. A non-invasive technique called Doppler ultrasound can show blood flow through the carotid arteries. All of these imaging techniques can help in assessing the risk of serious conditions such as stroke. Angiogram of the neck and of the head and neck. This image shows the carotid arteries in the neck and the arteries in the brain viewed from the front. A contrast medium has been used to highlight the arteries. Multiple 2D slices were taken and combined to form this 3D image. Respiratory system. The upper respiratory system from the nostrils to the nasal cavity and larynx and down to the pharynx and down to the larynx can be viewed directly by endoscopy direct as the tonsils, android, and vocal cords. They also make it possible to identify a flexible endoscope may be to identify blocked or bleeding areas such as narcotics, such as pull-ups in the nose or larynx of the vocal cords. To view the nasal cavity and pharynx, a flexible endoscope can be passed into one nostril, and then down into the throat. If one of the larynx or one of the pharynx or larynx needs to be viewed, the endoscope can pass down through the mouth. Endoscopy view of the nasal cavity. This view shows structures of the back of the nasal cavity from where inhaled air passes in the larynx, the uppermost part of the larynx. 4. Sagittal MRI scan through the head and neck. This view through the center of the head shows most of the major structures: the brain, the brainstem, and spinal cord, the skull and upper vertebrae, the nasal cavity and part of the sinuses, the tongue and the soft palate, and the epiglottis and larynx. So that's it for today. I'm going to read another one today later on. That's it for today's video. Peace out.